Good morning, everybody. Welcome to the broadcast. My name is Kelly, and joined with me is Erica Ponchat, our International Director of Recruitment and Programs. Good morning, Erica. Thanks for being here with me.
Hey, good morning, Kelly. Thank you so much for introducing me here. I had a little bit of technical difficulties getting on this morning, so thanks for everyone's patience. We're so excited to be here again with you guys for our third live broadcast. These have been going really well. We appreciate all of your feedback. Today, we're going to have some exciting things to talk about. We're going to do our Employee of the Month. We're going to talk about Christmas and the holidays in America. And we're going to chat a little bit about immigration. We've got some of our nurses joining us today for clinical information. So there's a lot of stuff happening, and we're excited to have you guys joining us. And just as a reminder, if you haven't joined us before, please drop in the chat where you're joining us from. We love to see where around the world all of our nurses are coming in and signing on from. And also, if during our broadcast you have any questions at all or any feedback for us, feel free to drop it in the chat. We might not get to everything today, but we'll do our best. And if we don't, then your associate, one of your international deployment advocate or your international program associate will follow up with you and get you the answers that you need. So without further ado, let's get started. I am joined this morning by one of my colleagues, Presley. She is one of our international employee supervisors, and she's going to talk to us about our November Employees of the Month. And I believe we might even have them joining us today. So, Presley, what have you got for us? Oh, I can't hear you, Presley. I think maybe your mic is on mute, which is what I was struggling with before. She is going to work on her mic. Well, I will go ahead and announce our November Employee of the Month nominees. We had Leah Marie, Raul Joseph, Jessen D, David M, Erica Janine, great name by the way, Erica, Nino Angelo, Wimia B, Patrick R, and Flory Jean. And there's Presley. Congratulations on being nominated. That's a really big deal. All of our internal associates get to read your nominations and vote every single month. So we get to take part in that as well. It's really exciting. Presley, is your mic? I think maybe you're on now.
Hey guys, I just wanted to jump in. Presley, I think we're getting a lot of audio back from your mic. So I'm going to unfortunately, I have to mute you. I don't know if you have a mic plugged in, but is everybody else hearing that background noise as well?
Yes.
Okay. All right, Presley. Well, you can, feel free to stay, and we will move right along. We are really proud to announce the November Employee of the Month. Joined with us today, Nino Angelo. He's an RN from the Philippines. Congratulations, Nino. And we also had David, a nurse from Uganda, currently working in Alabama. I'm going to go ahead and add you guys to the stage. Welcome.
Hi.
Thank you for being here with us today.
Good morning.
Hey. It's so good to see both of you. Congratulations on winning November Employee of the Month.
Thank you. Thank you.
So we would love to know, what does being Employee of the Month mean to you? David, do you want to go ahead and start?
Yeah, thank you very much. Good morning, everyone. Or hi, everyone from wherever you're joining in. Yes, winning the Employee of the Month is a huge honor to me, as it demonstrates that my contributions are making a difference, and my hard work is being recognized. And then, this award is also kind of it's a great reminder to me that the positive impact that I have in my team that I work with at Southeast Health in Alabama, and the team that I work with in Healthcare so International, wherever they are in Ohio, that they and it continues to motivate me to go above and beyond in whatever that I'm doing. It's truly a true recognition of that my colleagues and my my colleagues, my supervisors are appreciating my efforts, that I'm a valued member of the team.
I love that. Thank you for sharing that, David. How long have you been in the United States?
Well, thank you very much. I've been in the United States for 2 years now. Entering my third year of my contract, actually.
Wonderful. Nino, would you like to share what winning means to you?
Hi, thank you so much, guys, for having me here. Um, I feel honored. I don't know, I'm speechless at first because I thought I was just nominated, and now got the Employee of the Month award, and yeah, I'm honored to be recognized as that. Um, just like what David said, it feels nice to be recognized with all your efforts. It's very humbling to know that your work has been recognized, and to know that every effort you put in can actually make a difference to the lives of others. And it inspires me to keep going every day, to work hard, pick up a lot of shifts, not only to my unit, but to 5 other units in a hospital, to help around. And it gives me this motivation to keep moving forward, to learn despite all the challenges. Every challenge is a growth it's an opportunity for growth. And I just want to go there, work every day and make a difference one shift at a time.
That's
Well,
great.
you both are making such a big impact, and we love reading the nominations that your managers and your colleagues submit on your behalf. It's truly amazing. So thank you both for all of the hard work you're putting in and the representation that you are doing for your countries that you have come from, and also in the United States for foreign educated nurses everywhere. Nino, how long have you been in the United States?
I've been here since 2022, like 2 years now. Yeah.
Okay, awesome. Would you both be willing to join us for our holiday traditions, our Christmas tradition segment that's going to happen next? We're going to talk to a couple of our internal employees, and I would love to have you both share your experiences of Christmas and the holidays in the United States and kind of what that's meant to you.
But yeah, I mean, if I don't have any shifts on that day, why not? Right? I would love to share.
Oh, we're gonna do it. We're gonna do it right now. So
Oh, right
we've
now.
got
Okay. All
yeah,
right.
right now, right now.
Yeah, yeah, I'm okay.
So we're gonna talk about life in America. And I have today one of the recruiters on our team. She's one of our top recruiters, Melissa, international recruiter, is joining us today, and Kelly. And we're just gonna go through some questions to help share with all of our healthcare professionals that haven't arrived to the United States yet about the holidays and Christmas in the United States. So anyone can answer this one. What is one holiday tradition that you look forward to every year, and why?
Well, if I could answer that one, it's seeing the lights, the decorations. I've seen where the houses are decorated so magnificently. They go way, crazy, if I can say, with decoration, Santa falling off the house. And also here in Cincinnati, we have like light shows as well. You can drive through, sync your radio to the music and watch the lights go about. Or here at the Cincinnati Zoo, they also have where you can enjoy the zoo during the day and then see the zoo come to life with the lights. You can visit Santa Claus or ride the Polar Express train through. So it's just seeing the lights, decorations, and just, having that little, joy, seeing that. Definitely love seeing those.
What about you, Kelly?
I would have to agree. I definitely love seeing the lights. It's my favorite holiday tradition. I think recently, I haven't really gotten into it yet, but Elfie is a newer tradition, I think, in the United States. So Elfie is a little elf stuffed animal that I guess how it goes is sometime before Christmas, maybe the start of December, the elf comes down from the North Pole, and the parents tell the children that the elf goes back to the North Pole every night to tell Santa, what they've been up to. And what the parents have started doing, which I'm excited to do because I now have a toddler. So the parents will position Elfie in really mischievous places overnight so that when the children wake up, the elf is into something else. So whether that's the cereal box is knocked over or they wrapped the Christmas tree in toilet paper, they'll position the Elfie in all these funny little scenarios. And so I think that's something that I haven't really done yet, but I'm looking forward to trying.
For me, I would say, and Kelly, I did that with my boys, and then I got tired of it because I had to position the elf every night, and I was like, this is getting old. So I'm glad they are older now, and they don't believe in the elf or Santa anymore. But I love to go. We normally go as a family and cut down a Christmas tree. Or we'll go to like a Christmas tree farm and get one that's already cut down, and then we bring it back. And oh, you have a picture. This is not my family, by the way. I do have pictures. I should have shared my own. But then we, bring the tree back and decorate it and put lights on it and ornaments, and it's really beautiful. So I enjoy that. How do you usually celebrate the holiday season with your family or friends? I can go first. Since nobody wants to volunteer. We normally, like on Christmas Eve night, we'll go to our church and have a candlelight service, which I love because it's like it's all dark and it's just strictly by candlelight. And then it's like silent. I feel like the world is almost silent on Christmas Eve in the United States, and so that's pretty special. And then we wake up in the morning and usually, open our presents and enjoy family and friends. So that's probably my favorite part. What about you, Kelly? Oh, Melissa, you go.
Oh, sure. So it's kind of twofold. So I'm from Jamaica, so my Christmas traditions are kind of hybrid between there and here. So having a Christmas dinner is also a big thing, like a big festive thing where it will include, rice. We have something called gungu peas, jerk chicken, curry goat, and the whole likes. And then it cooks. It's all day. It's almost like Thanksgiving here. You'll cook all day, have that little joy and jolly and merrymaking with your family. And then you sit down at the end of the day, kind of, fellowship with each other, kind of reflect over, the year, because Christmas is a big deal, back home. So I think I just like being, with family. So also having that Jamaican culture, we have that second family get together, essentially. So that's what I also like, just the food.
That's awesome.
Nice.
What about you, Kelly?
Yeah, I would say it's the aspect of getting together with family. I get together with my dad's side of the family on Christmas Eve. So it's really great to see everybody, including my great grandma, and we'll eat dinner. And then the little kids will each do a gift exchange. So they'll open a gift, and then, that's pretty much what we do. I'm really curious to know how David and Nino have kind of transitioned into Christmas and what you guys have carried from your home countries.
Back in the Philippines, we used to celebrate this big party during Christmas Eve, and we gather up with my brothers and sister and with the rest of the family. We attend masses, like I think 9 masses every night, and until the Christmas Eve. And after that, we have this big celebration, fireworks and everything. But unfortunately, I can't do it here because we're just most of the time working. And I'm looking forward to going back to the Philippines maybe next year as soon as my contract ends or whenever I get my leave approved, and maybe I can do it again, celebrate that Christmas season, with the family.
Nino, I have been to the Philippines several times, and you guys start celebrating Christmas in it's usually August or September. We will
Yeah,
fly into
within
the
that.
airport and it's very tropical, and then there's Christmas trees and presents and everything already out in the airport, which I love.
Yeah.
David, what about you? What do you guys what's been a holiday tradition in the United States that kind of surprised you?
The holiday tradition here, the lights too. I mean, I just find it amazing and surprising seeing how houses and yards are kind of decorated with all lights and all these fancy lights. That really surprises me and really amazes me. And then talking about, how I have adjusted to the holiday season in America versus back home in Uganda. I mean, the way we usually celebrate it here, I mean, that's kind of identical to what Uganda is. First and foremost, we usually go to church on the Christmas Eve, pray, and then listen to the Christmas carols or the Christmas songs, and then come back home. But then the difference that we usually have between here and then back home is we usually open some of the gifts that very night, like on the Christmas Eve after we leave church. And then others are open the following day on Christmas Day. But back home, we usually open Christmas gifts on the day after Christmas, which is the 26th. So that's when
You guys
we
get to
to
open presents like 3 days in a row. My kids would love that.
Yeah, I mean, back home we open them on 26th of
Okay.
December, but here we open them on Christmas Eve,
Oh, I
and then
see.
sometimes some of them we open them on Christmas Day on the 25th in the morning.
David, what advice would you give to someone who is celebrating Christmas here, their first time? What would you say to them?
Well, interesting. I would say that I know, coming from another country to a new country, and it's your first time to experience Christmas or big days in your life, within this new country can be a little bit, can cause both mixed feelings of excitement and anxiety, not knowing how you can best enjoy your day because you're still probably during your transitioning period. But I would say the advice is if you can link up with some friends you got, if you can, link up with the friends at church, friends or in your social circle that you've already made, and join them, it can really make the Christmas day colorful actually, or the holiday season colorful for you.
That's really good advice. Really good advice. Thank you for sharing that. What about you, Nino?
Yeah, I totally agree with David. Like if you can link up with your friends, yeah, you do that. Yeah, explore other places. There are a lot of places here, especially here in New Jersey, like near cities or near areas here that there are a lot of Christmas trees, lightings, and everything. As a matter of fact, we went to New York last week, and it's very
Oh,
amazing. And this is my first time experience this the Christmas tree in Rockefeller. I used to watch that in screens only back then, but now I was able to see it with my daughter and my wife, and it's a very nice feeling, and it brings up the memories that I just used to dream about this, and now I'm looking at it and I'm like, oh my God, I was in tears during that time. It's
wow.
nice.
That is incredible. I,
Erica, can
I've
I ask
never
a
been.
question?
Yeah, yeah.
So I was curious. I wanted to know, like, we have our entire all the candidates that have joined the passport program. Well, for those that could make it this evening, but what advice would you guys give to candidates who are still going through the process during this time?
Never lose hope. Um, Keep that faith, and just whenever there are any like challenges or like something that hold you back, just keep that faith and hope that it will happen someday. And if there are requirements that needs to be submitted right away, you just you got to work on it right away. It took me 10 months only since I signed up with Health Carousel, and now I'm here
That's
after
incredible.
that.
The stars aligned for you.
Yeah.
We've got a lot of candidates that are feeling discouraged right now because of retrogression setting in and the visa backlog. David, what would you tell people about the process and the delays and how to encourage them to keep the hope?
Well, first and foremost, I want to mention to Mr. Nino that, it took you 10 months and to me it took me 5 years. So,
Wow.
what I can say to those people are being first, I mean, it took me 5 years because of COVID. I mean, when they had started the process and then I got hit by COVID or COVID hit. So kind of most of the things slow down. But people are still in the process. I want to say one word to them is trust the process. I mean, you are with the right agency, you are with the right recruiting agency, you have all the support that you will need to transition from wherever you are to come to America and get started. And I promise you, you will hit the ground running because of the support that you will be getting from the agency that you have signed up with. So I would say trust the process. You are in the right hands, and everything is gonna be all right.
Thank
Agree.
you, David. That was very encouraging to hear. And I think, Nino, your story is incredible. And a lot of people are commenting in the chat about it. But David, I think yours is probably a little bit more normal for a lot of people, depending on what credentials you have. Some people haven't passed NCLEX yet, so it depends on all of that. And then, like you said, sometimes things are just completely out of our control, like COVID happened. And that just put so many delays for everyone. And then, now we have kind of retrogression that's set in, which is very normal. I mean, I've been at Health Carousel for over 11 years now, and most of the time there is retrogression. Most of the time there's a wait. Nino, I think the stars align for you. And I see some people asking in the chat, how did you get here in 10 months? And I'll answer that. So the immigration process itself does not take a long time as long as there's visa availability and you have every document that you need and everything is current and active. It can take 6 months to 1 year for some folks, but the challenge right now is that there isn't visa availability. So even if you had all of your documents, you have to wait until your priority date is current so your embassy interview can be scheduled. So that's Nino, the stars aligned for him. We did have a couple years that were kind of during COVID where the visas were all available and there were some extra visas because people had not used them during COVID. So a lot of people got through really quickly. And now, unfortunately, we're back to waiting again. So, it's, you guys have both been very lucky to have made it here and we're so excited for you. Is there anything else that you know what, let's ask a couple questions of the audience because I think we have a little bit extra time. So we have people joining us from Nigeria, Saudi Arabia, Iran, the Philippines, Pakistan. I'm seeing so many, the UAE, Ghana, Kenya, so many different places. So for those of you that are online, what is your favorite holiday tradition from your home country? Share it in the chat. We'd love to see it because I know all around the world people celebrate Christmas. Oh, we've got Maldives. Melissa, I saw some people chatting you about your Jamaica traditions that you may have missed a couple things.
Sorry, I saw it. My bad.
Anyone want to chat what they like to? Okay, let's see here. Cheryl says Simbang Gabi. I don't know what that means. Is that maybe a food? Oh, hello from Nigeria. All right. Well, maybe they didn't understand the question. I'm not seeing any race. Oh, going to church, Cheryl said. Thank you. Yeah, that's one of mine as well. Mayla is sharing. She's inspired by your story, Nino. She's more than 10 years still waiting in the Philippines, and Mayla, it will happen for you eventually. I know our last live broadcast, our winner, he had waited for, I believe, 15 years because he had been retrogressed and then had a setback. And then, I think it's important to note that we never abandon our nurses. And like I said, I've been here 11 years and I've seen people fail. They're NCLEX 4 times and we still are supporting them or, trying to pass their English exam. And we continue to help our nurses. We never let them go. Let's see here. Christmas because it's family reunion. That's a good one.
Go ahead, David.
Achilles wants to know.
Erica.
Oh, yes, David.
I wanted to say something about, somebody who is concerned or, who is in this process and is, like seeing it's taking a little bit of some time. I want to make a correction here in that, I would say it took me roughly like after getting all the credentials that I needed, like Miss Erica said, that sometimes, it's kind of on individual basis on, which credentials you have and what you need to get together for you to, move ahead in the process. I mean, for the 5 years, it so happened because I had to correct a lot of credentials, getting my NCLEX done. And then after doing my NCLEX, then COVID hits and I'm not able to progress to do my English. And then, when they opened up and I was able to do the English, then I would say from the time I had everything set to my interview, actually, I probably also took like, if not 6 to 8 months, after getting everything that I needed, my credentials together, to doing my interview, my visa interview. It took me 6 to 8 months. And within 2 months after my interview, I was already in the US. So I would say too, after getting my credentials, it took me 10 months roughly, more or less, like Mr. Nino did. So it's all about, how fast you get your credentials done and what the current status of the visa processing is, that determines how fast you go through the process. But like I said, regardless of where you are in the process and your stage, it's just trust the process. Just, keep in touch with your IPA, IDA, and everything will be in line.
That is excellent advice. And Bridget says, thank you for the encouragement, David. And that's so true. I always tell people, I'm like, the process itself, the immigration part, doesn't take very long, except if there's a big backlog. But so much of it is dependent on passing your NCLEX, getting your English exam, and you're waiting on CGFNS to issue your visa screen certificate. And it's like you just have all these things. Your university has to send your transcripts here or your diploma there. And it can sometimes be so many things out of your control. But we are here to root you guys on. And I appreciate David and Nino's encouragement. I'm seeing a couple more comments in the chat. People enjoying time with family and friends is a really big one I'm seeing over and over, and eating food with family and friends. We like on Christmas, we have a lot of ham. I never want to see ham after Christmas for at least another year because of how much ham we eat around here. Ruth Ann says, have you tried puto bumbong in the Philippines, Miss Erica? And I have not. I've tried many things. The lechon, let's see here, pancit. Pancit is my favorite thing that I've had in the Philippines. I do like the adobo. I've had chicken and pork adobo, and you guys have great seafood. But I haven't tried that one. I'll have to try it when I'm back again. Sheila says Simbang Gabi means Aguinaldo Novena Mass for the Advent season. Okay, Sheila. So Nino, you might know what that is because you were talking about the masses in the Philippines for Christmas Eve.
Which one?
She says Simbang Gabi.
Simbang Gabi. Yeah.
Okay,
That's
I'm
like
saying it incorrect.
Oh yeah. The Simbang Gabi is like going to church every night, like at 9 nights before Christmas. Before Christmas. Yeah.
Wow, that's incredible. I like that. That sounds like a good one. We have Sarah joining us from Tanzania. I love this. All right. Well, I think we've covered a lot with Christmas. Anything else, David or Nino, you guys want to add as we wrap up?
No.
Well, we appreciate you joining, and thank you so much for your advice to our candidates in the pipeline. I think that was very encouraging to hear it from you. And I hope that you both have a wonderful Christmas and holiday season, and you get to spend some time with those that are important around you.
Thank you so much, guys, for having us.
And congratulations again on Employee of the Month. Okay, so our next segment that we're going to move to today is nursing in the United States. And I'm joined by two of my colleagues here in our office that are on our clinical team. They are nurses that support our nurses that are on assignment and beyond. They do so much more. So I have Derek here with me today and Ashton, and I am going to let them take over because this is their area of expertise. They are subject matter experts, and they're going to talk to us today about some topics clinically.
Yeah, thanks, Erica. And just since we're on the topic of Christmas, I wore my Christmas sweater today for this. So just wanted to share.
I did not, unfortunately.
And so I know last time our colleague Ryan went over, kind of the first step of the nursing process, right? The equipment and supplies possibly needed to do an assessment. And so today, Derek and myself will be talking about and reviewing in detail, like what a head to toe assessment here in the US may entail. And so, Derek, do you want to kick us off?
Yeah. So a head to toe assessment is typically completed during the first encounter with your patient, right? So it's a very high priority. It gives you a good benchmark for where your patient's status is at. So you can compare and identify if a patient is deteriorating throughout your shift through electronic documentation. This also allows kind of the entire care team to see how the patient is doing without them being there at the bedside. The head to toe assessment is a great way to help you prioritize your patients accordingly also too throughout your shift. Some of the members of the care team might include people like the doctor, nurse practitioner, care managers, nursing assistants, and therapists like even respiratory or occupational. But here in the US, we use a systematic approach to our assessments to enhance clinical efficiency and ensure the patient's needs are met. Assessments can vary based on nursing specialty and overall patient condition as well too.
Yeah, for sure. So for like my background being a mother baby nurse, dealing with the newborns and moms after they go through labor, I would check the woman's fundus every assessment. With Derek's, background, his is more of that med surge. And so there was be no reason for him to check a fundus. So there are differences in assessments based on specialty. But overall, the foundation of a head to toe assessment is pretty much the same.
Great examples though, Ashton. So now let's review the steps of a general head to toe assessment. For the sake of time though, we'll be kind of discussing this in relation to a stable patient in a perfect world, right? While assessing the patient, it is wise for the room to be well lit, just to ensure that nothing is missed. The goal is to complete a full assessment, typically in about 5 to 10 minutes. If the patient is alert and oriented, it is best kind of practice to communicate your actions to the patient prior to the assessment and as you're navigating through it. This can kind of ease any stress that the patient might be feeling, as they could be anxious with the unknown, especially when navigating the genitourinary system. Communication with the patient also is essential when assessing the patient's cognitive status and builds a rapport with the patient. Here's an example of a head to toe assessment for you to view as we talk about it. I do believe that there will be a link in the chat as well too to the image so that you kind of can view it at a later date if you wish as well too.
Yeah. And so the assessment really begins right when you walk in the room, right? You walk in, you introduce yourself to the patient, the visitors, family members, friends, whoever may be in there at the time. And that's really the best time to assess their level of consciousness. Are they alert and oriented, right? Do they know who they are? Do they know where they are? Do they know why they're in the hospital, right? And so this is also kind of will lead you right into kind of getting their vitals, right? Vitals include the blood pressure, heart rate, respiratory rate, temperature, oxygen saturation, and even pain. And so, here in the US during my nursing school, they always taught us, pain is the 6th vital sign, right? You should always ask, pain with every assessment. And so we here in the US actually have one machine that can test and obtain all the vitals for you. And so you obviously have to hook it up to the patient to obtain those vitals. But one machine can do a lot for you, and it's just a time saver. And so I'm kind of curious how many of you guys have used a machine like this, or are you guys used to doing, everything manual? I'm just curious. If you could put in the chat, that would be really cool. And then, again, to save you even more time, doing things simultaneously, right? So obtaining the patient's blood pressure while you're getting the oxygen saturation level with the pulse ox, those two vital signs, the patient shouldn't be speaking during, and so why not get 2 at once, right? So definitely finding some ways to save yourself time is huge and really key to get your head to toe assessments in that 5 to 10 minute time frame.
And that comfort level will come with repetitions through this. The more you do it, the more comfortable it will become. As Ashton said, some of these things can be done simultaneously. So like you can see on the diagram that the skin assessment is kind of last on the list, but just realize that you'll kind of be assessing the skin from start to finish as you move through the checklist. You'll be looking for areas of concern, which include things like wounds or pressure areas, discoloration, temperature, and even elasticity. This is another prime example of multiple things being assessed at once.
Yep, absolutely. Absolutely. We're all about efficiency and time saving, right? Because you never know what's going to pop up during your shift. So it's always a great idea to do things, multitask, right? And so, as you're going through your assessment, looking at the skin, obviously we're going to start at the head, the top of the body. So head, eyes, ears, nose, mouth, neck. And so for the eyes, you could look for discoloration of the sclera, right? The yellowing, is related to jaundice. So looking at that, pupil size and reactivity to light, very, very important. The ears, looking for any drainage coming out of the ears, even skin breakdown around the ears, right? From nasal cannulas. Especially if it's a patient that is admitted for a while, constantly wearing a nasal cannula, they can get some breakdown. And so paying attention to that. The nose, noticing any blockages, drainage with that. Also skin breakdown from a nasal cannula because they sit right there. So you definitely want to pay attention to that. The mouth, discoloration. If you see cyanosis, that's obviously an oxygenation issue. Drooping of the face as a whole, that could be expected in a known stroke patient, but that could also be you identifying like, oh, I think they are having an active stroke, right? So paying attention to, what's going on in just this small area is critical. As far as the neck goes, you would want to look for like JVD. You would look for enlarged lymph nodes, the thyroid gland, tracheal deviation, all of those things really give you key insight to what's going on in your patient at the time.
Yep, and excellent points. But again, from the head to toe, we're going to continue to move down the body from the head. So the next we would kind of reach is the thorax. So specifically the front and the back of the torso. This does include the pulmonary and the cardiovascular assessments. In a perfect world, a patient would be sitting on the edge of the bed or in a chair, but there could be situations where the patient's unable to sit like that. In those circumstances, you would just adjust the head of the bed to probably around a 30-degree angle. And then when you're ready to assess their back, you would recline the bed to be flat. And that way you could roll the patient on their side and to assess the back, right? There's an image too. So when we get to auscultating the lungs, you will assess this kind of in an alternating pattern from like left to right. There are 4 points on the anterior side and 8 points on the back. You will be observing for any accessory muscle use or abnormal breath sounds. Normal breath sounds should be clear throughout all the lobes. But a key point to kind of note too is just as you're moving down towards the bases of the lungs, those lung sounds could naturally just sound more diminished, right? Not necessarily anything to be alarmed by, just something just to be aware of, right? What's normal and what's not normal. And again, that comfort level will come with repetition and continuing to listen and kind of navigate this assessment. I know there's like a bunch of different abnormal lung sounds, and I just will say that usually like places like YouTube are just an excellent resource to kind of, give examples of those different types of lung sounds. So just something to think about if you were curious about, buffing up your knowledge on those different kinds of lung sounds.
Yeah, yep. I was just going to say, looking online is such a great resource to, practice and just kind of listen to if you're not used to, auscultating your patients, listening to what normal sounds like and listening to what abnormal sounds like, right? I'm curious if you guys know, the differences, like the abnormal lung sounds, like what are some examples? If you can put those in the chat, like I'm really curious to, hear if you guys, have experienced patients with abnormal lung sounds,
Stridor versus wheezing versus, yeah.
Right. Yep. Exactly. So, Derek touched on the lungs, so I'll touch on the heart. And so, To assess this body system, you really need to not just listen to the heart, but also feel for pulses, right? So this allows, you as the nurse to identify, abnormal rates, rhythms, murmurs, right? And so I did find like a super cute little diagram to help you remember the different areas of the heart and where to listen to them. And so this image is basically a mnemonic device. And so there's 5 areas of the heart. And the mnemonic device is all people enjoy Time magazine. And so the A is for the aortic, people for the pulmonic, and joy for Herb's Point, time for tricuspid, and magazine for mitral. And so, this is super. I mean, I just remember in nursing school, like I loved these because it just it made it so much easier to remember so many things. And so I'm also curious if you guys have any others that you've used or that you continue to use in your nursing practice. Throw those in the chat because those could also help others learning, or maybe they're struggling with an area and you could really help them. So definitely put those in there. And I think could be really helpful.
Excellent, Ashton. Yeah, mnemonics and just like little tips and tricks for your own brain are just a huge resource
Yes.
to, again, just keep you on track and to keep you aware of what you're looking for, and make it easily attainable for you to kind of pull that information from your own brain, right? But yeah, excellent, Ashton. We'll continue to move down. So we'll move down into the abdomen. So as we get to the GI assessment, it should be performed in the order of inspection, auscultation, percussion, and palpation, right? So the look, listen, and feel. This is where you can listen to the bowel sounds to ensure that there's no issues with like GI motility. You will also listen to and assess all 4 quadrants of the abdomen. You will be looking for any areas that might be painful to the patient also, right? So again, thus continuing your pain assessment as you move through the body. After that, you will be inspecting the musculoskeletal system. So things like range of motion, strength, edema, and reflexes will kind of be the focus here to see if there's any deficiencies from the right side versus the left side. Again, including your patient in the process in regards to maybe there is some weakness in their right side. And they let you know though through questioning that they had a stroke 10 years ago and that's just been lingering from that period of time. Or as Ashton kind of used before with the stroke, maybe this is new symptoms that they're experiencing and they don't know what they're experiencing, but you can kind of connect those dots for them. But another example is like if you notice edema in the legs, you can measure those areas by kind of pressing in with your finger, and then removing it to see if there's any pitting, and you can measure that as well too.
Yep, absolutely, absolutely. And so the last and final part of the head to toe assessment will be the GU, so the genitourinary system. And so with this being, such a sensitive area and very private, it is typically saved for the last part of the head to toe assessment. And so again, like Derek mentioned earlier, in this, in this discussion, talking through your assessment. So you should be talking through, it's really best practice to talk through the entire assessment, right? Especially if it's your patient's first time being in a hospital, right? They don't know what's going on. They are probably terrified because they're in the hospital, right? So kind of talking them through what you're doing can really help build that relationship with your patient, build trust, and make them just feel a little bit more comfortable. Like, I can't even imagine, someone just coming up to you and poking you, right? And you're just like, what are you doing? So it is best to kind of talk through your head to toe assessment, like explaining what you're doing and why. That could really, really benefit your patients. And especially during, when you are looking at the genitourinary system for sure.
And that's really it. That's what a general head to toe assessment looks like. It can seem like a lot, kind of as we just navigated the whole thing. But just remember, like this is a tool just to keep you on track, right? To make sure that you're getting the full picture of your patient, so that you're getting the information that's needed as you need to delegate care or need to prioritize the care. Remember, this is going to be done during the first encounter with your patient. whether that's at the start of your shift or if the patient's kind of admitted midway through your shift and assigned to you. So yeah, the head to toe assessment is critical for the whole care team as well too, and it just guides the care plan of the patient as they kind of navigate through their time in the hospital. But yeah, thank you guys so much for just taking this time with us to navigate this information. We really hope it's helpful to you. And again, kind of as Nino said, and David too, we have an excellent clinical team here to support you guys too with any sort of questions or issues or hurdles that you're navigating. And we do look forward to continuing conversation with you guys.
Wow. Thank you both so much. This was a lot of great information. And there's so many things that I didn't even know. Obviously, I'm not a nurse, but lots of new information. And we actually got quite a few comments and questions in the chat.
Awesome.
And this probably won't surprise Derek and Ashton because they talk to a lot of our foreign educated nurses every day. But a lot of people commented that they are very accustomed to the manual assessments and not so much the machine that you were talking about, Ashton. But we had a couple questions and a couple people commented, like in Saudi Arabia and Australia and the UK, they are using some of maybe the monitoring machines that you're using.
Oh, awesome.
Ariel asked, is this head to toe assessment template something that can be used for all hospital, or does it depend on a hospital policy?
Yeah, great question.
Okay, yeah, I was just going to say, right, this is mostly kind of a nursing tool. Typically, as you kind of navigate through the orientation process in a hospital, you'll be assigned with a preceptor, and they will kind of, be showing you their own process for going through things. Generally speaking, though, yes, the nursing actions, this head to toe assessment is kind of built into our process, right? So a veteran nurse will kind of have this all mentally in their brains as they kind of go through it. It won't be like a checklist on a clipboard that they kind of go through. But maybe early on in orientation, this is a paper document that just kind of helps keep you on track to navigate through. Ashton, maybe you have a little bit more kind of input on that too?
Yeah. And so the head to toe assessment template is just kind of an example, right, of the areas that you need to hit for your initial assessment with any and all patients that you encounter. And so again, it's not like a form you fill out and turn in. It's just something to help guide you until you do get your routine down. You know what's expected of you. And so just an example to kind of give everyone a visual of what a head to toe assessment really entails here in the US.
And as Ashton said, there is kind of a specialty kind of nuance to it, or some kind of differences and variations that kind of come depending on the specialty you're in. Mom baby looks different than med surg, which looks different than dialysis. So this is just something that we thought might be beneficial to you as you kind of prep and plan and prepare for your coming to the US. And yeah, there's definitely not a downside to kind of doing some mental kind of homework with this, and kind of maybe just taking some example patients from your own mental history that you can kind of like just navigate and kind of fill in the information for.
So the next question we have is, Ashton, you were mentioning a machine when you first started talking. Augustine wants to know what the machine is called. And then Felizardo asked, is it the same as a cardiac monitor? So kind of two different questions.
Yes.
Both about the machine.
Yes, great question. So it is different than a cardiac monitor. The Vitals machine is there's so many different brands here in the US. So
typically it's the Vitals machine, or Vitals on a stick, you know what they'll call it.
So it's basically this little box that might be the size, of, possibly like the screen of a laptop, we'll say. And it's just on this literal like pole that's on wheels. And so you just drag it around the unit to each patient, or some facilities may have a Vitals machine hooked up to the wall. And, that one machine is meant for that one patient in a room. And so there's, many different brands that it's really based on the hospital and the partnership that they have with companies that have medical devices. And so there's not just one brand, but definitely it's literally called a Vitals machine.
Yep. And again, it will measure the blood pressure, which you still will set up similar to the manual, but then it will read it for you. Temperature, pulse, the oxygenation of the patient, and their heart rate. And the difference for the telemetry box, right, the heart rate monitor, that's different in the sense of, typically those are reserved for more of the kind of the critical care floors or the cardiac floors. And that is a separate little box that usually sits in the patient's gown pocket, and it's connected to different points in their body. And that will kind of send the patient's heart rate to kind of a big computer screen over at the nurse's station, and will kind of relay what the patient's heart rate and rhythm is, where, then you can kind of, you can have all the patients up in the nurse's station, and you can kind of keep your eye out for, if there is any abnormalities that pop up or any alarms that are going to be going off.
Awesome. Maymuna asks, how many times inpatients are assessed in U.S. hospitals per shift?
Yeah, great question. And so this will really vary based on hospital policy, the diagnosis, like why they're in the hospital, and also, if they just got back from, a surgery, if they just, like from my experience doing mother baby, after the baby's delivered, the mom and the baby is assessed every X amount of minutes, and then it goes to an hour, and then it goes to every 2 hours, then it goes to every 4 hours. And so, and eventually once they are, over 24 hours out of delivery, then it's every 8 hours. So it really does vary based on what's going on with your specific patient, and the policy of the facility and your unit.
Yeah, and the head to toe, especially I feel like the biggest kind of purpose of, at least the strength for me, was at the beginning of your shift, right? Just say, hey, we're going to get a baseline for kind of all these different systems. After that, there might be things like, kind of like Ashton was saying, where it's kind of more of a focused assessment, right?
Yeah.
This might be a neuro floor, and so then maybe the checks, the frequent checks, maybe every 3 hours or every 4 hours, is mainly focused on their neuro status, right? Is there any changes with them cognitively? So it won't necessarily be, oh, I'm going to be assessing the skin 4 times throughout my shift. No. That's kind of where those differences lie. I hope that kind of answers that question for her.
Yeah, and I do want to add, there's never a bad time to assess your patient, right? If you feel like things are headed in a bad direction, think your patient is just looking off, assess them, right? Yeah. There is no exact time or a bad time to assess your patient.
And that kind of sparks something in my brain, because I know probably a lot of people watching are very used to paper charting, but here in the U.S., mainly a majority of the time, it's going to be computerized charting. And I will say a lot of the computerized charting is geared to, especially your like initial documentation on patients, is kind of geared to a layout of a head to toe. So again, as you're collecting the data, either through the head to toe, assessment tool, or as you're just navigating the patient through your own documentation on the computerized charting, they will kind of naturally walk through those progressions too. So yeah, if that's helpful.
You guys are a wealth of information. I think I love all the feedback that our nurses are adding in the comment section. And I think what I'd like to know from you guys, and I know you kind of reiterated this earlier, but I think just saying it again is important, because we have so many people coming from so many different countries and different ways of doing things in their hospitals and facilities. What is the best advice you both have from now talking to and coaching so many of our nurses through their transition to practice, in how they can be preparing for this? Because as you stated, Derek, and many have stated in the chat, so many are used to the manual assessments and not using computer charting. So what's kind of the best thing they can be doing right now before they arrive to the United States to help with that?
I would say a big thing, once you get stateside, because obviously you're going through so many different transitions, and it can feel like it can feel so huge and maybe overwhelming. And I just want to, again, just extend to you guys, just have some grace and mercy for yourselves as you navigate this space. This is a lot of information for any new nurse that's going to be kind of stepping into these places. There's going to be questions that any and all nurses are going to be having, whether they're born stateside or whether they're coming in internationally. There's going to be so many questions that you're going to have, and I know the biggest kind of concern will be like, oh my goodness, I don't want to seem like I don't know what I'm doing. But again, you're trying to figure out your flow and your rhythm, and the only way you're going to be able to do that is by asking questions. So maybe in your first week you're going to have 100 questions, and that's going to feel, you're going to be like, oh my goodness. But again, maybe a month from that point, you're going to be kind of bringing more so 20 questions to the table. And then another month down the road, it's going to be 5 questions. You're going to be learning, and this information is going to be kind of sticking. So don't feel that you're going to have to be the perfect, have everything buttoned up and everything ready to go on day one. No, this is a learning process. And so do have some patience with the process and have some mercy on yourself too as you navigate it, okay?
That's
Ashton,
great
I don't know if
advice.
you have any.
Yeah, I agree. Definitely giving yourself some grace and patience. Absolutely. And definitely just, I know we supply you guys with like health streams and all of those things. Really, take in what it's sharing with you, right? Also getting, hands-on practice, where you're at now, if you have the ability to start listening to patients, right? Listen to their lungs, listen to their heart. I know in some countries, that is, the doctor's responsibility. And so, that is something that the nurses do here. And so I think learning those sounds, whether that be through YouTube, if you can't listen to your patients, right? Kind of teaching yourself, right? Really getting, involved into, US nursing, like what that looks like, and really learn about it, right?
Mhm.
Compare it to what you've been taught, what you are currently doing, just so you kind of have some, a way to prepare yourself, know what's coming.
And we heard too that there's some variation in the time it takes to actually get here stateside, right? So some of you watching might not even be working bedside right now, and so maybe it's a good time to, maybe if there is positions open, by you, to kind of get back bedside and maybe start getting into those repetitions, into that flow again, kind of getting that knowledge brought back up to the surface. That might be helpful for you too. So,
yep, great point, Derek.
That is excellent advice. And you guys are getting lots of shout outs in the chat right now from everyone. Nicole said a platform like this is so very important and they're learning so much.
awesome.
And lots of thank yous, lots of hearts and hand claps. So thank you both so much for joining us. And again, for everyone online listening, Derek and Ashton are amazing and they're here to support you guys. So, when you do arrive, if you are struggling and you do have questions that you are afraid to ask your team at the hospital or you need extra help with, they are going to be here to help support you, them and their team. And they're incredible. So thank you both for joining us, and hope you guys have a great Christmas with your families, and we will see you later.
Yeah, thanks, Erica.
So our next segment, without further ado, jumping right along, is our visa bulletin update for January of 2025. I can't believe we are already moving to 2025. And I am joined today by my colleague, our Director of Immigration and Licensing here at Healthcare Cell International, Elizabeth McCullough. And she is going to go through and give us the update for the January 2025 visa bulletin. Hi, Elizabeth.
Hi, Erica. Thank you. Good morning, good afternoon, good evening, wherever you are in the world. I hope you are enjoying this lovely, joyous Christmas season. If you don't celebrate Christmas, at least, wrapping up 2024 and looking into 2025. So with that, we're going to move on to the January 2025 Visa Bulletin update. It was released by the Department of State last week. And I come bearing somewhat good news this month for January. There was advancement in all categories for all countries for January. And as a reminder, the visa bulletin is the dates of your priority dates that are going to be current come January 1st. The December visa bulletin still applies for the rest of December, and this January visa bulletin goes into effect starting January 1st. Your priority date, as you may know, or if this is your first time joining us, your priority date is your date in line for your embassy interview for your immigrant visa. So the visa bulletin, as a reminder, you're looking on the Department of State website for the current visa bulletin. You want to scroll all the way down to Chart A of the employment-based visa bulletin. As you may be aware if you've navigated this site before. If not, there's multiple charts. There's family-based category, there's employment-based category, and within each category there are 2 charts. You're looking for Chart A of the employment-based visa bulletin. And so you can see for our registered nurses, you're going to fall within the EB3 category, and then you're going to look at the top line of which country that you were born in. So this is going to be charged against your country of birth, not your current country of citizenship. So if you were born in China, India, Mexico, or the Philippines, you can see that each of those countries have their own column. All chargeability areas, except those listed, would be everywhere else in the world. So Canada, Nigeria, Kenya, wherever else outside of China, India, Mexico, and the Philippines. So for January, our dates are moving forward in the EB3 category. For the Philippines, we moved forward about 2 weeks. For all chargeability, again, we moved forward 2 weeks. EB3 India had pretty decent movement with 1 month moving forward, which is fantastic news for them. EB3 China moved forward an additional 2 months, so that's wonderful. And EB3 Mexico moved forward 2 weeks. So forward movement is always an exciting thing. As you look forward into January, make sure if your priority date has become current, making sure that you've met all of the requirements so that we can, get you to your embassy interview and that you're ready to go.
Excellent. Thank you for the update, Elizabeth. And Florence had asked, is the priority date, or I believe CC means country of citizenship, being used for the interview date? And I think you kind of answered that, but maybe want to reiterate that again.
Yeah, so the priority date is based on your country of birth. So there are some exceptions to that, depending if you have a spouse that was born in a different country. If you're in that situation, you should reach out to your assignee and discuss that, and they'll raise it to me. But in general, case complete. Okay.
Case complete.
Yeah, so you will need to be documentarily qualified in order to be scheduled for your interview date.
And their priority date will have to be current.
And the priority date needs to be current, yes.
So like both of those have to be true.
Yes, a lot of moving pieces.
It is. Felizardo, I wish that we had predictions for the next visa bulletin. We do not. We are right there with you, always wondering what the next priority date and visa bulletin is going to be every month. I wish we knew that. So I think this is all great information. Let me see if there's any other questions in here. Okay, I think we answered all the questions. And we're going to move on to a Q&A. We have been obviously getting a lot of questions about the Trump administration and kind of what that may look like for folks. And obviously, Trump he's not actually in office quite yet, but we're anticipating some changes, not anything super dramatic, but we had our top 3 questions that we're getting right now, and Elizabeth's going to go over those. So Elizabeth, the first question that we are getting is, will the Trump administration affect my chances at receiving a visa?
Yeah, so again, looking forward to January, we will be getting a new presidential administration. This happens in the U.S. every 4 to 8 years. And so we do have the benefit this time around that we have been through a Trump administration. And looking back at historical data, the number of visas available each year is at 140,000. It's broken down by countries and how many each country is allowed to have within each category. based on EB2, EB3, family-based, employment-based. So there's a lot of calculations within that. But each year, 140,000 visas are issued. And looking back over historical data, each year, again, 140,000 with some variations based on things that happen. For example, earlier in the 2000s, there was some things that happened, and then COVID happened, and then, there's variations, but in general, 140,000 every year will be issued. There is nothing that a presidential administration can do to change that. It is based on statute. It would take an act of Congress to do that, and they've never, discussed changing the number of visas available. So in terms of visa availability and receiving your visa, the Trump administration will not have an effect on the number of visas available.
Because remember, guys, we're talking about merit-based visas, and you guys are going through the correct and legal process to get to the United States. So we're here to support you through that. That's great information, Elizabeth. Number 2, is my visa going to be denied?
Right. Of course, we cannot answer that with any certainty without, taking a look at your background, your history, your qualifications. But as long as you, have, fulfilled the requirements of for the position, for the visa requirements, you have passed your English, you've passed your NCLEX, and you've provided all of your documents, and there's nothing in your history, prior visas being revoked. Visa denials in the past may or may not, we request that information and we review it and make an assessment, but we need to know things in your past within immigration that you've had in the past that could lead to a denial. But overall, the sentiment is that they're not going to be denied just because of a new presidential administration coming into office. But we assess all of our candidates and we let you know of any risk or potentials. But in general, no, there's no more risk of denial on January 20th as there is today.
Yeah, that's a really good point, Elizabeth. And in my time here, I've rarely seen visas get denied for our candidates. And like Elizabeth said, if it would have generally been something that was not disclosed to us previous with an immigration issue. So as long as you're truthful and honest and we submit all of the legal documentation, everything should be fine. Number 3 is, could I possibly get deported?
So this seems to be coming from maybe our nurses who have made it to the United States, or, if you're on your way to the United States with your immigrant visa, is there a risk that you could be deported? The answer is no, not any higher risk than, any other time within your time here. You're coming through, like Erica said, the proper channels. You are being fully assessed and vetted outside of the United States. The embassies are going to issue your immigrant visa, and you're going to come in properly, legally. And there's very rare instances where the immigration would reopen a case once it's been approved. Usually it's something completely egregious that might come up, but as long as you're coming through the proper channels, that's not going to happen. So, once you're here with your immigrant visa, there is very little chance that you would get deported outside of, what I just kind of said. And it would take a lot for them to reopen a case. They're looking more for people who have not come through the proper channels. They're not going through the embassy interviews and being approved for your immigrant visa.
That's good information, Elizabeth. And I know it can be anxious when you see the news and you see things that are being posted. But it is generally, this administration we are finding is focused on illegal immigration, and we are absolutely not involved in illegal immigration, and we are doing everything legally. And like she said, you're going to have a permanent resident visa and a green card, and eventually even be able to apply for citizenship. So We had a couple questions here. Chica asked, what happens if your English test expires before you are current? Chica, as long as your visa screen certificate is still active, you should be fine. Although it can sometimes affect your licensure in the United States if the Board of Nursing, where you're going to work, requires an active English exam. So that's something you might want to talk to your associate about, depending on where you may be selected or going in the United States. But generally speaking, you just need your active visa screen certificate at the time of your embassy interview. And I don't know. Let's see here. Was there something? Oh, how is the standard cost of living in the United States for nurses in the USA? I heard that inflation is extreme in all states. Inflation does affect us all, and it's an unfortunate reality. The other reality is that we are still in the United States and we still make good money and we are able to support ourselves and our family. Not to say that it doesn't put strain on your budget sometimes. You know, groceries are higher and it's definitely going to affect everyone. You know, you may not even recognize it when you arrive to the United States, and maybe it will be lower by the time you arrive. But we, you know, living here might notice that eggs used to cost, you know, $1.50 for a dozen, and now we might have to pay $2 for a dozen. And we're in Ohio, so that's kind of low prices. Some of the other states are a little bit higher. But I don't know, Elizabeth, do you want to comment on that at all?
I think you covered it well. Inflation is affecting us all, but you know, you just work through it and you know, budget. But
Sharon De La Cruz, my daughter is turning 21 on March 2025. Is there a chance she will be coming with me? My visa was approved when she was still 19. Thank you. That's a little bit of a tougher one. That might be one, Sharon, that we have to work with you on directly to find out a little bit more details about your situation. I don't know if you have anything further on that, Elizabeth.
I would say just reach out to your assignee on that one so we can take a look. There are some circumstances where we can freeze an age for a period of time. So I would need to know more about your case. So just reach out to your assignee and they can flag it over to me and I'll take a look and see what we can do.
Yeah, and Grace, you ask a very similar question. So you should reach out to your international deployment advocate or international program associate so we can assess your case individually. Felizardo, since we have movement for the visa bulletin, does this mean that there are no more backlogs? That does not mean that. Elizabeth, do you want to explain that a little bit further?
Yeah, so there is still the backlog. As you can see, they moved forward for most countries by 2 weeks. So on October 1st, a new set of 140,000 visas came available. So that is why in October, if you were following along the visa bulletin, we had a large movement forward. And then they kind of held the numbers for the next couple of months. There was no movement for November. There was no movement for December. What they're doing this year, or, you know, what we've heard discussed that they're doing this year is kind of doing a little bit slower increment as they work through the backlog. Because last year, for the government fiscal year, as a reminder, it runs from October 1st to September 30th. So sometime in early September, they completely ran out of the 140,000 visas. So there wasn't a lot of movement, you know, clearing out of people who were current. And by the end of September, they were completely out of visas. So on October 1st, we got a whole new allotment. And so they're trying to, you know, work through the backlog while trying to keep movement forward as much as they can, but it's going to be a little bit slower progress, but consistent, hopefully. But yes, I mean, there is still the backlog, about two-ish years or so of backlog. So they're still working through it. Unfortunately,
Yes.
there's nothing we can do to make it go faster, but you know, we just keep an eye on it and we celebrate when there is movement.
Yeah, and it is difficult. I know it's hard not to get discouraged. I do want to remind you, I think I mentioned this earlier on the call, but over the last decade, the whole time we've been in business, we've generally seen that the United States is in a state of retrogression for the EB3 visa and most visa types, but there's only a certain amount allotted per year. And as most of you guys are probably aware, more now than ever, there are thousands of nurses around the world who are taking and passing NCLEX and attempting to come to the United States. And there's also a lot of folks in the United States from other countries that are working on different types of visas that sometimes file for an adjustment of status. So they're also utilizing those visas. So we are seeing a lot of the visas get utilized quicker, and that's what is causing the backlog. But there are still the same amount of visas being allotted every year. So you'll eventually get your turn. It just might take a little bit longer. And I know that's not the news that you want to hear. But the good news is we are here by your side. We are holding your hand. We're here to support you. And we're going to do our best to encourage you every single month. And you've got your associate who's there, again, to support and cheer you on. And don't lose hope. If you were on in the beginning, you heard David talking. It took him about 5 years to get here. In our previous employee of the month, it took him almost 15 years to get here, which is not probably going to take most of you 15. But I just want you to be aware that people do sometimes have to wait, and eventually you will be able to get here and make your dream come true. So keep the hope. That is all the time that we have today to go through questions. We're so thankful to have all of you online. If you didn't get your question answered, reach out to your IPA or IDA, and we'll do our best to get the information that you need. And I hope that everyone enjoys their holidays or Christmas in the country that you're in, and spend time with the people that you love and are most important to you. And Elizabeth, thanks for being here with us today. And we will see all of you guys next time for our January broadcast. Bye.